Welcome back to Melissa Talks, where we talk all things uniquely you. For the month of March, we are celebrating Women's Month by highlighting amazing women that are leading and making an impact in various industries. Today's guest is Dr. Marla Trapp. Dr. Trapp is a board certified family medicine physician, fellowship trained in geriatrics, and a certified medical director. She has been in practice for 14 years, working in primary care and geriatrics, as well as serving as medical director. Dr. Trapp, welcome to the show.
Thank you so much for having me. I'm so glad to be here.
You're so welcome. Thank you again for being with us. So we'll get right into it. So when it comes to various diseases that affect women, especially Black women. We do know that there are many, but there are two disorders that stand out the most, and that, of course, is cardiovascular disease and also breast cancer. And so when we get into our questions here, the first one would look to ask, what are some of the recommended screenings and tests for early detection of heart disease in women?
Well, I'm so glad to be able to speak on this topic because it is super important, or these topics. Cardiovascular disease in particular is important because it is the leading cause, heart disease is a leading cause globally of
Mhm.
mortality or death in women. So it's super important for us to bring awareness to this topic and to be able to understand what things that we can do to try to reduce our risk. So I'm going to go through some of the screenings that are recommended.
Mhm.
And before I get into the screenings, I just kind of want to give you all a point of reference so that you know what the screenings mean when
Mhm.
we give them a level of importance. And just for reference, most of these screenings are going to come from the United States Preventative Task Force Services, which is a body that tells us on different topics what is recommended and not recommended.
Mhm.
So through that body, a grade A recommendation would mean that there's a high certainty that there's a benefit, and so it's recommended. B means there's a moderate benefit, and so we still recommend it. A grade C means that it's on an individual basis between the patient or the person and their provider to discuss individually to see if that would fit for them.
Mhm.
And then D is not recommended. And I would mean there's insufficient evidence to say whether it's recommended or not recommended on that particular topic.
Okay.
With that being said, so one of the recommendations is to encourage what would be something that seems kind of simple, but um, it doesn't happen a lot of times, which is a healthy diet and physical activity to prevent cardiovascular disease. And
Mhm.
actually, the B recommendation, meaning that it's recommended, says it is for people with risk factors. But in general, I would recommend it for everyone.
Yeah.
So the risk factors would include people that are 18 or older with elevated blood pressure, elevated cholesterol, or something we call metabolic syndrome. And just a point of reference there, metabolic syndrome is a combination of different conditions, meaning excess fat around your waist, or elevated blood pressure, high blood sugar, or
Mhm.
low HDL, which is your good cholesterol, or elevated triglyceride levels.
Mhm.
So if you have some of these risk factors, they definitely recommend incorporating a healthy diet and physical activity. Some of the other screenings that are recommended would be um, to screen for um, cholesterol. So you want to screen and make sure that your
Mhm.
cholesterol is stable because that can be a risk factor as well.
Oh, yeah.
Incidentally, they don't recommend a routine EKG, which was a previous, do you remember that was a previous
Yes.
recommendation in the past? That is no longer recommended
Oh, wow.
for, yeah, low risk individuals or even those with moderate to increased risk. They only recommend EKGs if a person is symptomatic now. And the
Mm.
same thing is for the echocardiograms. Those are the ultrasounds that they do on the heart. That is
Mhm.
not like a screening test. Is really reserved for people that have symptoms.
Mhm.
So They also recommend when we talk about a healthy diet and healthy lifestyle, what does that mean?
Mm-hmm.
Um, a healthy diet would be trying to eat things like will increase your good fats. Nuts increase your good fats. Avocado, those are healthy foods. Lean meats like turkey, chicken, fish.
Yeah.
Those are kind of things that are clean eating and healthy activity. Or excuse me, clean eating, but healthy activity in addition is making sure you're having some kind of elevated heart rate activities, vigorous walking, whatever you can tolerate for at least 30 minutes for 3 times a week.
Yeah. Yeah. That's
So
good.
100 150 minutes or whatever you can get to have consistent. That's one thing that we as moms and
Yeah.
women, consistency can sometimes be a little tough because we wear so many hats, right?
Yeah, exactly.
Uh,
Exactly.
professionals, we have children, we have spouses, we're sisters, we're whatever that we do. And so,
Mhm.
um, it's easy to kind of pick up whatever the kids eat or,
Yeah.
put your little exercise activity to the side because, you got to run one child or run here and run there. But we have to make sure that
Hmm.
we are consistent and making sure we're making healthy food choices and continuing our activity.
Exactly. Well, definitely, that is so true that 150 minutes is necessary. And then the simple fact that we women wear so many hats and, it
Mm-hmm.
gets to the point to where we sometimes put ourselves on the back burner.
Mm-hmm.
And unfortunately, with that happening, some women don't even realize that they may be having symptoms of a heart attack of some sort or, or have issues that, could lead to cardiovascular disease, which we know can lead to a stroke or even into an MI of some sort or a heart attack. But with that comes a lot of stress and stressors.
Mm-hmm.
You did hit, of course, the dietary habits and how we can incorporate various foods. Thank you for mentioning that because sometimes our listeners don't always know. All right, they say eat right, eat well, eat different. Well, what does that look like, right?
Mm-hmm.
And
Mm-hmm.
so you mentioned some really great foods that can be incorporated within our diets. And so back to that stress aspect of it, how can women with managing all of those various things that can come along with stress look to improve, their cardiovascular health, and how can they manage that stress to be able to do that?
Well, I think that's a great point. And one of the things that I've talked about several times in the past is the importance of trying to bring those stress levels down because I won't go
Mhm.
into too much detail, but cortisol is a stress hormone. And
Yes.
when that hormone is elevated, it's a fight or flight response. It's intended to be for a short period of time.
Right.
And in that fight or flight response, you do different things. You eat high energy foods. And high energy foods, incidentally, are like carbohydrates. They give you quick energy shortly for a
Hmm.
short period of time, but then you come down on a low afterwards. And
Right.
so that carbohydrates over time, guess what? It sits right on the midsection. So we want to have healthy habits to reduce our stress, and that could be different for different people. That could look like reading a book. That could look like,
Mhm.
some people do relieve stress through their exercise. Some people may pray or meditate.
Yeah.
These are different activities that can bring down the stress in a healthy way. Sometimes it may be just as simple as you got to be comfortable with saying no. I mean, we generally have great
That's
hearts
good.
and we want to help everybody. And
Good.
I mean, it's true, right? You
Yeah.
want to, but every now and then, that nurturing, that loving, that compassionate part of you
Yeah.
um, can inadvertently put yourself, like you mentioned, on the back burner, and then you're increasing your stress level without giving yourself the opportunity to bring it down a little bit. And so I generally tell patients in practice that, you treat your thing that is important to you or thing that helps you to reduce your stress as something like an appointment. You will make sure to make your doctor's appointment. So
That's good.
whatever that activity is for you, you make that just as important. On Saturday at 8 o'clock from 8 to 9, that is my hour. And you be okay with protecting that hour because in the long run, it helps you to be a healthier you. And
Right.
if you can't be a healthy you, then you can't help or participate in all the activities you have committed to. So,
Definitely.
one of the things I want to highlight as well, as we mentioned, some of the healthy stress reducers is some unhealthy stress reducers.
Mhm.
Alcohol, smoking, lack of sleep, um, those are things that will not help in a healthy way, I should say, to reduce your stress. Because I also see lots of people, it's one glass of wine to get to sleep at night, and then it's two and three. And so ultimately, those can increase your cardiovascular risk factors down the
Mhm.
road, even eating. Some people stress eat. And
Yeah.
so I want to call attention to that as well. You have to recognize that if you're stress eating, and especially those high energy foods,
Hmm.
again, it's going to cause weight gain, which can lead to obesity, and obesity leads to, not only cardiovascular disease, but also diabetes and other things. So we want to make sure that we're incorporating healthy habits to reduce our stress.
Yeah.
You can you
Uh,
you can
uh,
even tell them that you heard that, shopping, hey, if it's within the budget, right?
yes, yes, yes. Definitely within the budget these days. But I want to, go back to that point that you made, gently saying no, or, it's okay to turn down some things. And I have come to learn, Dr. Trapp,
Right.
thank you for saying that, N-O, period. It's an
Correct.
absolute sentence.
Correct.
Don't we?
Amen.
And it's hard. Like you said, we have great hearts and we want to help everyone and we want to be all to all people. But that's just not healthy in many instances and circumstances. So we really have to take that into account. And thank you for bringing out that aspect of those things that are considered to be negative things to help decrease stress. Because oftentimes, like you said, it could be one drink to get to sleep one day, and then down the road, it's 3 to 4 drinks to, be able
Correct.
to get to sleep. And that, of course, can lead to negative outcomes as well. And so, in these instances, we do have listeners who may, already be there to the point that they have to take medications, right?
Correct.
So, what role would you say that medications play in looking to prevent heart disease, and when should someone consider them?
So we are going to talk. I want to definitely touch on that, but I want to just say one more point about the stress reduction.
Yeah, yeah.
We talked about some non-pharmacologic ways, but there are also times when it is okay also to seek professional help in the sense of if
Yes.
you need to speak with a therapist to talk, or even a psychiatrist for
Yes.
medication to help to get through a transition, say big stressors in your life, maybe the death of a loved one,
Yeah.
or taking care of an elderly patient or elderly parent.
Yeah.
Those type of things can be big stressors, and you can't necessarily feel the relief, so to speak, that you would like to maybe after a walk, and it's really affecting your ability to do your job or your ability to do your regular responsibilities. Please reach out and seek help with a therapist or a psychiatrist if that's what you need to get through that time.
Mhm.
Um,
Good.
but going back into medicines for prevention of cardiovascular disease specifically, um, we have aspirin is one of the medicines that can be used. And I'm going to go back in reference to what we were speaking of before with the USPSTF. The recommendation for aspirin is a grade C for ages 40 through 59 with a
Mhm.
10% risk or greater of cardiovascular disease. And remember, the C recommendation means it is determined on an individual basis.
Yes.
And that calculation is based off a calculation that was developed from the American Heart Association and the American College of Cardiovascular Disease. And basically, they take into different factors. They take into account your age, um, your race, your sex, your cholesterol levels, your blood pressure levels, whether
Mhm.
you have diabetes or not, and they come up with a percentage that is your risk of cardiovascular disease. So for aspirin, if it's 10% or greater with
Mhm.
those ages between 40 to 59, it's still talk with your provider. It's an individual basis recommendation because aspirin is not harmless, right? There's risk of bleeding with that as well. So that particular medication is an individual basis C recommendation.
Mhm.
For our statin medications, these are medications that manage your cholesterol.
Mhm.
If your cardiovascular risk is less than 10%, that is also a grade C, meaning um, it's determined on an individual basis. However, if your risk, based off of that calculation, and you're between the ages of 40 to 75, is greater than or equal to 10%, it is recommended for you to start on a statin medication.
Mhm.
And that is to help to prevent cardiovascular disease in those individuals.
Yeah.
And then lastly, over the counter, you can find omega-3 fish oils, fatty acids. Those are
Mhm.
helpful in reducing triglycerides. So if you find that um, you get your report back from your doctor and your triglyceride levels are elevated and you're not necessarily wanting to start a statin medication,
Mhm.
that could be an option definitely for you to discuss with your provider.
Oh, that's good. This is great information, Dr. Trapp. And moving from cardiovascular disease now into breast cancer. We know that it is one of the leading causes of death as well in women, and especially Black women as well. So, moving into this, what are the key symptoms of breast cancer that women should be aware of?
Well, sometimes there are no symptoms, unfortunately,
Yeah.
and that's why we have routine screening. But some of the symptoms that we can note or you should look for if they are present would be if you feel something abnormal in your breast, like a lump,
Hmm.
if you have any abnormal discharge from your breasts, like from your nipples, anything that's discolored or bloody. Um, if you notice any asymmetry in your breasts, meaning they don't look the same,
Hmm.
one, sometimes you might have a little bit of difference, meaning one breast might be a little bit larger than the other, but you know your body and you know what's
Right.
familiar to you. And if you're noticing, hey, this one has gotten much bigger than it used to be, or this one has changed color in some kind of way, those kind of asymmetrical findings are something to get looked at, as well as if you notice any dimpling, meaning your
Hmm.
skin may be smooth and normal initially, but now an area looks like it has a little dimple, or it's um, looks like it's caved in a little bit compared to what it used to be. Those are abnormal findings that you definitely want to mention to your provider, as well as pain. Sometimes we can get pain with our menstrual cycles, and it's temporary, it comes and goes. But if you notice that you're having pain that's kind of persisting and it's not associated with your menstrual cycle, definitely something that you want to have a second look at.
That's good. How can regular mammograms and self-exams aid in this early detection of breast cancer?
So, as we mentioned, that's a great question. As we mentioned, sometimes you don't have symptoms at all.
Yeah.
And so the pendulum has kind of been swinging. Most recently, it's back to age 40. But the pendulum kind of swings on what age to start the screening. And in general, if we're saying no risk factors involved at present, it's recommended to start at the age of 40 and
Mhm.
screen every year thereafter. And USPSTF says that you can either go screen every 2 years, but I think it's kind of physician and provider, or excuse me, physician and patient, depending on if you're comfortable doing every 2 years or annually. I personally, in my practice, still do annually
Yeah,
um,
I
to
like that.
make sure that we capture anything that looks like the start of anything abnormal in order to have the best chance
Mm.
of, getting rid of it and eradicating as soon as possible.
That's good. What steps can, women take to reduce their risk of developing breast cancer?
So in breast cancer, some risks are present genetically, and they have genetic screening and genetic testing for that.
Mhm.
But some things like hormone replacement therapy has a slight increase in risk of breast
Mhm.
cancer.
Yeah.
Definitely obesity because of the extra weight and the extra estrogen, it kind of has a similar effect to increasing the risk of breast cancer. So you want to make sure it kind of all relates back to our healthy habits and physical activity, again, that we try to do our best to maintain routine activity and healthy eating to try to minimize risk of both cardiovascular disease and breast cancer.
This is good. This has been great information. Like I've said multiple times here, I cannot stress enough that this information is necessary. We
Yes,
don't always
yes,
hear, this out there, although, of course, there are many different avenues to get it from, but not everybody has the opportunity to, always get to the provider. We know there are people still dealing with insurance issues, not being
right.
able to see a doctor. But everybody has YouTube, right? Everybody has a
That's
way to
right.
listen to YouTube of some sort, and this is going to be on YouTube. So,
Awesome.
so I'm just, to be able to get the word out, to get the information out, however we can get it out to, the masses to be able to hear this is, what this is all about. So I just want to again say thank you so much.
Oh,
How
absolutely.
can our listeners find you on any social media platforms?
Um, I can be found on Medicine Mom 17 on Instagram.
Awesome, awesome. Well, thank you so much, Dr. Trapp, once again for joining the show. This is Melissa Talks, where we talk all things uniquely you. Be sure to tune in next week to hear from another amazing guest, as we continue to highlight women that are excelling among us. Until next time, bye.